if you can hear us, my name is Nora Henley. I'm the Director of Marketing Communications at the Spina Bifida Association. I'm really excited today to do our Ask the Expert with Dr. Brad Dicianno. He's our Associate Medical Director, and we did Ask the Expert for Parents just a few weeks ago with Dr. Bry, and we had set this up knowing that it would be really nice for adults to have an opportunity to ask some questions to our adult experts. So Dr. Dicianno, if you just want to share a little bit about yourself, and then we'll get into the first question.
Sure, thanks, Nora. So my name is Brad Dicianno. I am a rehabilitation physician. That field is also called physiatry. So you may hear us being called physiatrists or physiatrists. And I direct the Adult Spina Bifida Clinic at the University of Pittsburgh. So my area of expertise is caring for adults.
Yes, it is. Okay, let's jump right in. The first question. This person said, I often struggle trying to explain what spina bifida is to my general care team, neurologist, primary care doctor, etc. What is the best way to coordinate care if you don't have access to a specialized adult spina bifida clinic?
So that's a great question because it really represents most of the adults in the United States, right? There are a lot of adults out there who don't have access to an adult clinic. So there's different models. Certainly some adults do continue to go to pediatric clinics throughout their life, but for those who don't, it's really important to find a set of providers who really understand your condition. So for most adults, I do recommend a primary care physician. The primary care physician doesn't necessarily have to have all the knowledge about spina bifida to take good care of you. They can help with care coordination and really the basic medical needs that the general population needs as well, like managing your high blood pressure or diabetes. But another type of doctor that's helpful for a care team for an adult is a physiatrist like myself. So that's a rehabilitation physician, and our specialty is also called physical medicine and rehabilitation, or PMNR. So that type of doctor can really take care of a lot of your medical needs as they're related to spina bifida. So they can handle issues related to mobility and bowel and bladder, and they can manage wounds, and they can prescribe equipment like wheelchairs and braces. And there are even some physiatrists who have specialized training in spinal cord injury. So if you find some doctors out there who are fellowship trained to take care of folks who have traumatic spinal cord injuries, they often have also the knowledge and linkage with other providers who care for, who are important for caring for people with spina bifida. And then I would also say, urologists are also important parts of the care team. A physiatrist would have linkages to urologists who treat people with disabilities like spina bifida. And then depending on, your own unique special needs, you may need a neurosurgeon or orthopedist. But again, I think a primary care physician and a PMNR physician can be sort of a team that can link you with those other specialists that you might need.
Yeah, how would somebody, a lot of people aren't familiar with PMNR doc. So how would somebody find a PMNR doc? That's a good way to start. That's
a great question. So there are different organizations out there. One of them is called AAPMNR. It's aapmnr.org. You can actually find a physiatrist by looking up your zip code on their website. We can, provide the links after the talk for anyone that might need them. Also, you can find information just by contacting us at SBA through the National Resource Center, and we could help you find physiatrists in your area.
Yeah. Okay. Thank you. All right. This one plays really into it, and you kind of just covered it, but let's just give like the snapshot. If somebody's looking to start seeing individual doctors because they don't have a clinic, they don't have access to a clinic, what types of doctors or who are the specialists that are most important for an adult with spina bifida to be seeing?
Yeah, again, it will sort of depend on your own unique medical needs, but most adults need a urologist. If they have a shunt, they may need a neurosurgeon. And then, like I said, a physiatrist and a primary care physician are really important parts of the team. Depending on any orthopedic issues that you might have, an orthopedic surgeon. For women's health, a gynecologist would be important. So there's lots of different, specialists. And the complicating thing in the adult world is that, adult specialists tend to be very specialized. So an example is that in orthopedics, adult orthopedic doctors treat a specific joint. So you might need a different orthopedic surgeon for an ankle problem versus someone else who would treat your hip or spine. So there can sometimes be a lot of providers on the adult side. So what you also need is just someone to coordinate that care and make sure that all of your doctors are speaking with each other. You know, a physiatrist can do that. A primary care doctor can do that. But you need kind of like a hub or like a medical home for somebody that's going to be the central source for communication among all those different providers.
Yeah, and a lot of adults who do coordinate their own care also take that on themselves, which can, many people have said, often feels like a full-time job. So to find somebody who might be more willing to be a part of that process would be incredibly helpful for a lot of people. And I bet you a lot of people have not thought about a PM&R doc in that sense yet. So
yeah, it's something that PM&R docs are trained to do, coordinate care, because we're very team approached. We're used to working with physical and occupational therapists and speech therapists and neuropsychologists. So it's just naturally part of our training is working as a team. So it might be a good fit for some people that have access to a rehab doc.
I didn't even know that. That's really cool. I did not know that. Okay. How can adults with spina bifida help educate the medical field on how to care for adults with spina bifida?
So repeat that again.
Let's rephrase this one. This is a phrase a little weird. Sorry. How can we, as adults with spina bifida, help to educate the medical field or people who might not know enough about spina bifida as medical professionals about how to treat adults with spina bifida?
Right. So that's a really smart question, because I think a lot of adults have learned that you have to be your own advocate, right? There are lots of doctors out there who don't know what spina bifida is, who don't really understand it well enough to be able to take care of you. And sometimes that's an awkward position to be in, to feel like you have to educate your doctors, but sometimes you do. And sometimes you have to point them to resources. So one really useful thing you can do is point them to our guidelines for the care of people with spina bifida. So those are available on the SBA website. They're also available as an app. And they're really written for providers to understand how to care for somebody who has spina bifida. And there's a lot of great information in there about adult care. So that would be a great place to start. There's also resources that SBA has for transition. So if you're a young adult and you're transitioning to a new adult provider, there are resources at SBA that allow your pediatric provider to provide information that you can take along with you and give to your new provider that will teach them about spina bifida, some basics about it, and also provide some really important information about you and what that new provider has to consider in your care plan.
Yeah, that's good. Just to reiterate too, for everybody listening, the guidelines are available in app form. And they are free to use, and they have a symptom tracker and everything in the app that supplements the guidelines. So not only can your healthcare professional benefit from them, but you can benefit from them in a lot of ways as well. Okay, thanks, Brad. We'll go on to the next one. This person asks, as an adult with spina bifida, I've noticed a serious gap in the treatment of adults with spina bifida. Nationally, there are only a handful of clinics that treat adults with spina bifida, and sometimes if there is, it's run by pediatricians. How does the Spina Bifida Association plan to address this gap in treatment?
Right. So there are lots of different approaches that we can take to try to mobilize more resources and more clinicians who can take care of adults. So it maybe isn't realistic in a lot of different healthcare settings for an adult clinic to exist for a lot of different reasons. Sometimes the institutions just aren't set up that way. Sometimes there's not enough funding for those adult clinics. But we do try to advocate for those clinics and really try to help clinics get off the ground and get connected and get resources and training where that's possible. But where that's not possible and where those clinics don't exist, it's really important to also build up the infrastructure of other ways for adults to receive care. So one of those ways is for us to just train more providers. So we were talking earlier about physiatrists, so rehab doctors. One thing that we can do is get linkage, have the SBA create linkages with other rehab physicians out there so that we know who's in different areas, which rehab physicians are willing to take on the care of adults with spina bifida, which ones have experience, which ones are interested but maybe need more education. So those are some pathways that we've followed, and we've found physiatrists in certain areas that have been underserved that are willing to take on patients. And we're looking to do that in lots of different states across the country. And we're not only doing that with physiatrists, we're also looking at doing that with other types of providers. So one is neurologists, another is family physicians, and a third is a specialty that many people don't know about, which is called med peds or medicine pediatrics. So these are folks who are trained in both internal medicine and pediatrics, and they treat adults, and their training involves a lot of education on how to take care of people with disabilities. So there are people who are med peds trained who are very interested in taking care of people with spina bifida. So those are just some examples of how we're at SBA increasing the workforce, increasing the number of people who can take care of people with spina bifida. And then of course, we also have a lot of educational opportunities out there for people who tell us they don't know enough, but are interested in learning more. And we at SBA can certainly provide those educational materials for those providers.
Yeah, it's been a priority of SBA for a long time now too. There's a lot of different things that you can also, I should throw this pitch in. Ramu, if you're watching, I know this is really important to you. And Ramu is from Georgia, and he's from the Spina Bifida Association, Georgia, Tennessee area. And he actually went and spoke, I think 2 years ago now, to a group of medical students with another adult with spina bifida. And I think that was a really fulfilling and cool experience. So if you're a part of a local chapter or you have friends in your area, it might be something to consider looking at getting involved too. I can share the blog that we wrote about that in the comments too. Okay, thank you, Dr. Dicianno. Next question is from Danny from the UK, who I mentioned. She is asking, what is your understanding and opinion of spina bifida occulta?
So that's a big question, but I can start by saying that there's some variations in spina bifida occulta. So usually what we mean when we say spina bifida occulta, it's a very benign form that's quite common. So there's a type of spina bifida where you're born with incomplete fusion of the bony parts of the spinal column. So it's the back part of the vertebrae that are missing. And most of those folks may have no neurologic symptoms. So usually it does not cause pain. It does not cause any bowel or bladder problems. There may be, an indication on the skin that lesion is there. So some people may have a tuft of hair or a discoloration of the skin or a dimple, but that's not always present. And this type of spina bifida occulta is very common. It affects, some literature says, up to 1 to 2 in 10 adults in the whole general population. So most people who have it don't know that they have it, and they commonly find out that they have it by accident. So usually, somebody gets an X-ray or some type of imaging, and it's found when they're looking for something else. That type of spina bifida generally causes no problems or no neurologic deficits over time. However, there's other types of occult spina bifida where you're also not born with an open lesion on the back, like myelomeningocele. You have a closed lesion that's skin covered, but neurologically there is something that's not fully formed with the spinal column or nerve roots. And so this type can cause a lot of symptoms. So it can cause bowel or bladder problems. You can have numbness in your feet. You can have back pain. You can have problems walking. So it's really important when you have any type of occult spina bifida to have a doctor who can tease out the difference between the two. A lot of these folks have back pain. And so are you having back pain because it's related to the spina bifida occulta and you have something neurologically, wrong in there? Or are you having back pain because of a problem that causes back pain in everybody else, and it has nothing to do with your spina bifida occulta. So some people, because spina bifida occulta is so common, people also have herniated discs, and they have, pulled muscles in their back, and they can have a whole host of different types of problems. So it's really important to find a doctor who can figure out, is this spina bifida related, or is this, a type of problem that can be treated like back pain in the general population that isn't necessarily related to spina bifida. And so rehab doctors can help figure that out. Neurosurgeons can help figure that out. There are even pain doctors who are trained to treat back pain. These pain doctors are often rehab doctors or anesthesiologists. And those might be some examples of different specialists that you could see if you're somebody with spina bifida occulta and having problems with something like back pain.
Super helpful. Thank you. Danny, I hope that answered your question and gives you a little bit of insight. This is a more specific question, but we actually have a few questions about shunt. So I'm going to ask this one first. This person said they had went to a magnetic shunt in 2016, and they're supposed to get it checked once a year. And because of COVID, they haven't been able to get it properly checked for almost 2 years. They have video calls, but they're very concerned that because they haven't had a CAT scan, it could be a bad thing. Is this something they should worry about? Should they go in for their CAT scan now, or are they probably okay?
Well, what's really important is to gauge what's going on based on symptoms. So if you're somebody who has a shunt, it's really important to seek medical care if there's symptoms of a shunt malfunction. So you want to be aware of signs like headaches, nausea or vomiting, changes in your vision, changes in your thinking, like being drowsy or confused, or problems with your memory. If you have any symptoms like that, or any unusual symptoms, you definitely want to go to the emergency room or to your physician and have that shunt checked out. Also, I might also just bring up the fact that it sounded like this person had a programmable shunt. And those shunts can be checked with a device. So you can actually check the settings on a shunt with a device and be able to see whether the shunt is set to the appropriate settings.
That actually, and the next question was about symptoms of malfunction. So you hit two birds there. I know this next question isn't particularly in your wheelhouse, but since this has kind of come on SBA's radar in the past year to 2 years in particular, I think it might be relevant. We've had a few questions about fertility and being able to conceive as a woman with spina bifida. This person wants to know if it's possible and how different it might be, and if they need to seek a specialist.
Yeah, so if you're somebody who thinks you would like to become pregnant, or thinks you could become pregnant, you should really seek care from a gynecologist or an obstetrician gynecologist, OBGYN, who's specially trained for what we call high-risk pregnancies. So not every woman with spina bifida will have a high-risk pregnancy, but those physicians are specially trained to treat pregnancies that can be complicated. And yes, women with spina bifida can become pregnant. Many women do. Many women have successful childbirths. But there's a lot of things that you need to consider and really plan out if you're somebody who wants to become pregnant. So an important thing to consider is obviously folic acid. You should be taking a prescription strength dose of folic acid before you plan your pregnancy, so that it's in your system when the baby is being formed and the baby's spinal cord is forming. And then during the pregnancy, there's other things to consider. Like, for example, how would you get anesthesia when you deliver the baby? Sometimes you can't get an epidural in your back because the epidural would go in the area where the spina bifida lesion is, and the anatomy there might be complicated. So the OBGYN may need to plan out how that anesthesia will be done in advance. Also, some women may not be able to give birth vaginally because their pelvis might be too small, or they might not be able to be positioned on the table in a way that would be safe for their back or that would be safe for the baby. So those are some things that need to be planned out in advance, and a reason why you should consult with an OBGYN early on when you're even just thinking about pregnancy. And the other thing that I'll mention is for men or women who are, thinking about genetics and the role that genetics plays in fertility, you may want to even consult a geneticist, and they can give you some advice about, risk of having a child with spina bifida if you have it yourself.
Yeah, and you just said all of that, and I just remembered that we also have an SBU for adults with spina bifida on fertility and becoming a parent. We already have a lot of resources to share after this webinar. That's a good thing. That's a really good thing. Okay, thanks. We'll go on. Okay, this one's about tethered cord. This person says that, or they say, is it common for an adult with spina bifida who has had multiple tethered cord surgeries as a child to again have a tethered cord as an adult?
Yeah, so what we see with tethered cord in adults is that, many people who have the tethered cord released, it can certainly retether. But we sometimes can see people developing symptoms as adults when something happens. So they may, have an injury to their back. They may fall. They may pick up something heavy off the ground. And these types of issues can cause then a tethered cord to become symptomatic. So it's a little bit different in how it presents in an adult compared to in a child. In a child, sometimes it will present as the child is growing. So as the child is getting taller, you may see the child present with tethered cord symptoms, but obviously adults aren't growing anymore. And so oftentimes it either comes on with no specific reason why we can tell why it happened, or there might be some event that happened that causes those symptoms to begin. And so then you certainly want to, have an examination by a doctor who can do a good neurologic examination to then determine whether you need imaging or any type of treatment for the tethered cord.
Yes. Okay. Thanks. We usually actually get a lot of questions about tethered cord. This person has a question about atrophy. It sounds like she's having a lot of pain. She says that she is now paralyzed and has atrophy in her legs so bad that they feel like concrete. Do you have any suggestions on how to manage that or help that?
So when we say atrophy, we usually mean the muscles are shrinking or the muscles are wasting away. So usually that happens when you have paralysis or weakness. You can lose a lot of muscle mass over time. If your legs feel very heavy or tight, there can be a lot of reasons for that. One reason for tightness of the legs is spasticity. That's when the muscles themselves get very tight. That can happen if you have a problem like a tethered cord or a fluid collection called a syrinx in your back. So if it's actual muscle tightness or muscle spasms, you want to see a doctor for that, because the doctor there are specific treatments that can be done for that. There are medications and injections and other things. Sometimes though, tightness in the legs can be from the joints. So sometimes when you don't move the joints, you don't stretch them, they can also start feeling very tight. And so some people need to have a regular stretching program, or when those joints become so tight that they can't be stretched and they start to cause problems, an orthopedic surgeon would be the right person to see what can be done about that. And then the other thing that I would say is that some people experience a lot of heaviness in their legs from swelling. So a lot of patients will get what's called lymphedema, or a special kind of swelling that happens in the legs. And there are also treatments for that. So the leg heaviness can be from a lot of different things. It's important to understand, why it's happening and what's causing that sensation. And that can kind of help you get to the right type of treatment, because the treatments are all different based on what's causing it.
Okay, thanks. I hope that answered your question, Wendy. this question kind of makes my heart hurt. This person says they were recently hospitalized due to cerebral spinal fluid building up and causing pressure in their head and leaking where it shouldn't. They'd have migraines, occasional eye blurriness, etc. They have spina bifida culta, and the neurosurgeon that they went to see didn't know much about spina bifida in general. They haven't had a follow-up consult and haven't gotten much word from the hospital. Where should they go next?
So definitely see a neurosurgeon. That would be the right type of doctor to deal with increased pressure in the brain. Um, a lot of people get confused between a neurologist and a neurosurgeon. They understand the issues similarly, but a neurosurgeon is the one that deals with the pressure, especially for people that might need a shunt. The other thing that I would mention is that some people continue to have symptoms and headaches, even when a neurosurgeon may say that, you know, their hydrocephalus is treated well and there's no need for any changes with their shunt. But some people continue to have headaches, and there are neurologists that are headache specialists. So it might be worthwhile to see a neurologist if the problem is a headache and you've ruled out shunt problems by seeing a neurosurgeon first. And then I would also say see an eye doctor. Sometimes a lot of these symptoms are related to issues in the eye, and that can also be treated.
Okay. Yeah, I hope you can get the right treatment to the person who asked that question. Then this question, I feel like a lot of people have something probably similar to this or could ask this. This person says they deal with they're not using a wheelchair, but they did just start to use crutches, and their chronic pain has gotten a lot worse over the past 5-10 years. What's a good way to manage chronic pain and prevent worsening pain as we age?
That's a good question. It's something that a lot of people deal with. Again, the treatment for pain really depends on what's causing it. So it's really important to see somebody who can do a good examination on you and figure out what is actually causing the pain. You know, we have a lot of doctors who don't really understand spina bifida so well, and they'll say, well, you know, of course you have chronic pain, you have spina bifida, but that's not really getting at the root of the problem. That's not showing an understanding that there's lots of things in spina bifida that can cause the pain. And so, you know, it could be an issue that a neurosurgeon would treat. It could be an issue for an orthopedic doctor. It could be an issue for a rehab doctor or others. And so it's really important to get a good neurologic exam. So I would start out with, you know, seeing one of those three types of doctors, a neurosurgeon, rehab doc, or an orthopedic surgeon, to at least get a good exam and figure out where to start with treating it.
Mm-hmm.
Or it can be more specific.
Yeah. And if you're a person who already has all of those specialists, maybe what you're missing is a PMNR doc or a primary care provider who could help you look at that from like a more holistic perspective on pain management. And
yeah, sometimes there's issues that aren't treatable with surgery. You know, people live with chronic problems, but that doesn't mean that the pain isn't treatable. You know, and a rehab doctor is one of those kinds of specialists that can treat issues that cause pain in a way that doesn't involve surgery.
yeah. Okay, this person listened to your podcast. So that's cool. And they said they really appreciated your insight and your wisdom, and they wanted to know what your opinion is on mental health practitioners in spina bifida clinics and what the need is there and how they can better advocate for themselves in the mental health world.
Well, first, thanks for listening to the podcast. That's an example of how we're trying to reach lots of different audiences, right? Like get the word out and treat and train professionals all over of different specialties. But I think mental health is really important. In the pediatric world and pediatric clinics, we need neuropsychologists, especially for both diagnosis and treatment. It's really important to do neuropsych testing, you know, when folks are kids, to get a good diagnosis and know how to treat issues ongoing throughout the rest of their life. But after, you know, even after you become an adult, you know, there's a variety of different mental health professionals that can be important. One is a psychiatrist Psychiatrists are trained to treat some of the, severe mental issues like depression or anxiety, and they often use medications, but they may refer you to other types of professionals too, like neuropsychologists who can do testing. Sometimes we have to do testing in adults to diagnose problems and figure out, what exactly is going on. If people are having symptoms, having a good diagnosis will lead us right down the right pathway and knowing how to treat it. And then finally, some people need counseling. That's really a really important piece of mental health care. And I think that, that's sometimes difficult to find for a lot of people for different reasons. One is that, it's not always covered by insurance. Sometimes it's really hard to find somebody that you connect with. But now I think with the advent of telemedicine, especially during COVID, there are a lot of mental health practitioners now who provide telemedicine services. And that may be something seriously to consider if you're having trouble finding a provider in your area. The telemedicine has opened up a lot of opportunities, for folks. And sometimes there aren't a lot of providers out there who specialize in spina bifida, specifically in the mental health world, but you may find folks out there who are understanding of perspectives of people with disabilities. And if you can find somebody like that, that can be really valuable.
Yeah, I agree. I think that's something, finding a person that you connect with can be really hard, but to your last point, finding a person who you can connect with who also is understanding of the impact of disability on mental health, from like a personal perspective and a societal perspective, can be very important in therapy. Because research does show that there is some trauma that comes along with hospital visits, a childhood of working through a multitude of issues. So whoever's out there and is worried about that, just know that you're not alone. And we do have some resources, especially around COVID, on our website for mental health. And we'll hopefully have more over this month, since this month is Mental Health Month. I feel like this next question, we kind of addressed this a little bit in terms of like chronic pain, but this person is now, they say, above the age of 40, and they're worried about losing mobility. Is there any advice you have to prevent a loss of mobility as they age?
So stay active. You may, this is another example where you may want to get linked in with a rehabilitation physician, because we pay very close attention to that. One of our top priorities is to set goals with a person and figure out what their own personal goals are. And that includes mobility. We try to preserve mobility as it relates to independence as much as possible. So sometimes, preserving mobility means using the right type of assistive device. Sometimes it means treating pain. Sometimes it means participating in an exercise program to keep the muscles as strong as possible, to stretch, and keep the joints as loose as possible. Sometimes it involves bracing. And those are all things that a rehab doctor can help with. The good news is that a lot of people who ambulate, who walk, when they're adults, continue to walk for a very long time. So, and the other piece of this, I would say, is, watch your weight. And one reason why people lose mobility is obesity. So it's really important to eat well, exercise, and try to keep your weight as under control as possible.
Yeah, for sure. I think we also have a guideline that could help with that. So I can link that in the comments after this as well. All right, everybody, Dr. Dicianno is a busy person, so I'll take like one or two more questions if somebody has them. Dr. Dicianno, I'll see what questions come in, but I asked him to do this, Dr. Brad, so I'm gonna ask you to do this too. It's your closeout statement. So what's like your billboard statement, the one thing you want adults with spina bifida to know or to take with them as being a self-advocate for them, moving forward into the rest of this year and the rest of life, as philosophic as that is?
If I could sum it up in one word, I would say prevention. So as adults, the key to remaining healthy is preventing problems that are going to happen as you age. So we see a lot of things complicating adult care, a lot of things that cause hospitalizations that could have been prevented. Those things are wounds, urinary tract infections that get out of control, symptoms of, shunt problems or back pain that people ignore for a very long time and don't seek help. So, pay attention to what's going on with your body and your symptoms. And, it's really important to get plugged into care so that if you take care of yourself, you exercise, you eat well, and you watch for these red flag symptoms, you can prevent a lot of issues that affect adults.
Yeah. I've seen like this question come in a bit, so we're going to finish on this, but thank you for that statement. That's really good advice. We talked about shunt malfunctions earlier, and I think this is so important, not just for adults with spina bifida, but also for parents to be cognizant of that, since we're in the time of COVID and you might not be able to go in and see your providers as much, that you might be missing some of the signs of a shunt malfunction. And this person asked a really good question, which is, how do you determine the symptom of the shunt malfunction from just a general headache or migraine?
That's a very good question. So, we can't always know based on symptoms alone. So if somebody is having a shunt symptoms where we're worried about a shunt malfunction, we have to do some testing to figure out if it is the shunt. So it might involve getting a CT of your head. Sometimes we have to get an X-ray of the shunt. Sometimes we have to check the programming on the shunt if it's a programmable shunt. And we even sometimes have to do more than that. There's other procedures that a neurosurgeon can do to really check to see if it's a shunt issue. And in some cases, when we go through all of that, we find out that everything's okay with the shunt, then there are other treatable causes of headaches, both related to vision, so see an eye doctor, and also just other types of headaches, which a neurologist can help with.
Yeah. We also, there's another thing that I can link in our comments is we do have a shunt malfunction card. That's just literally like a printout card you can have that has the symptoms of a shunt malfunction for you to just keep in handy. I also lied. I'm going to ask you one more question. Nobody asked this, but I know this is something that you obviously have written about because I've taken it from you, and that's sleep apnea. And I think a lot of people don't know that there is a strong tie between sleep apnea and spina bifida. So I just wanted to know if you could kind of touch on that and give your knowledge and insight into people who maybe don't even know what sleep apnea is and how that could be affecting them, and also how to find out if they do, or if it's worth them finding out.
Yeah, it's really important. And in fact, sleep apnea can be another cause of headaches. People that have chronic sleep apnea that's not treated, it can cause headaches. It can cause, also problems with your heart and lungs. So people with spina bifida have a lot of risks for having sleep apnea. One is having a Chiari malformation. So people who have the myelomeningocele type of spina bifida often have a Chiari malformation, which is basically a difference in the way that the back of your brain is shaped. And there can be pressure on that back part of the brain. And that part of your brain controls your breathing while you sleep, especially. And so some people can have a decreased drive to breathe while they sleep. And that's what we call sleep apnea. Symptoms of that might be morning headaches. It might be feeling tired. It might be snoring or gasping for air during the middle of the night. And we don't like to have that sleep apnea being untreated for a long period of time. You can see a specialist who's often a pulmonologist or an ENT, ear, nose, and throat doctor, and they can do a sleep test, a sleep study to determine whether you might have sleep apnea. And then there's different ways to treat that as well. I would also just add that people with spina bifida sometimes can be overweight or obese. People that have excess weight can also have a different type of sleep apnea from just having too much weight around their neck and body that influences how they sleep. And some people with spina bifida also have scoliosis or curvature of their spine. And so they may have some restrictions in how their lungs can expand when they breathe. So for all these reasons, pulmonary or lung function is really important in this population. And if we treat those things adequately, again, prevention can prevent long-term problems down the road.
Yeah, now we're getting a bunch of comments about sleep apnea, so I'm really glad that we covered that.
Yes.
We do have Dr. Dicianno wrote, he writes an adult newsletter or participates, it's your clinic's newsletter for their adult clinic that comes out quarterly, right? Is it quarterly?
Quarterly, yes.
Yep. And the two newsletters ago, there was an article called Sleep Apnea that we adapted for our blog so that we could share it with everybody. And it's really great. So I'll put that in the comments as well. I think we even linked a free app in there that you can download to record your snoring. So if you're unsure or if it's just something that's kind of made you worried, you can always approach it that way. Although snoring isn't always obviously a telltale sign that you have sleep apnea. But yeah, something to be very aware of and think about. So okay, if you guys have additional questions, Dr. Dicianno and Dr. Bry from our last Ask the Expert are our medical directors at the Spina Bifida Association. So anytime you ask a question through our National Resource Center, if it's not something that we're qualified to answer or answer right away, the question goes to them. So if you have additional questions, you can always contact our National Resource Center. It's available to everybody in the community at no cost. There's a phone number on our website, or you can just email sbaa@sbaa.org. So Dr. Dicianno, I want to thank you so much for your time. As always, you're very wonderful, and you gave a lot of really great advice and wisdom tonight. And I hope everybody had some of their questions answered. And, we hope you stick around as we'll have more Ask the Experts coming up. So
thank you, Nora. Thank you, everybody, for listening and for your great questions. And, prevent and advocate. And we look forward to hearing from you.
yeah, good advice.